Welcome, everybody. It's so great to see you here. Just quick, by a show of hands, I'm assuming everyone's a medical student. Do we have M1s, M2s, M3s, M4s? How many of you from Indiana? Awesome. Okay, our one representative from Indiana. And is anyone from an osteopathic school? How about allopathic? That's everyone else. Got it. Okay, great. Thanks. That helps me orient so I can help kind of give you some more relevant advice. I completely echo what Nick said about getting advice from multiple people and how you're going to get different advice from others. But all of the things he mentioned are really important. So I'm going to talk a little bit about options in emergency medicine. I'm Kathy Hiller. I'm the Director of Undergraduate Education at the University of Arizona in Tucson. We now have a Phoenix campus, and thanks again for having me. So there's a lot of emergency medicine residencies out there, over 220 at last count. And there are things that are important and things that may not be as important to you. We're going to talk a little bit about location, the difference between academic, community, and county, small versus large residencies, what RRC accreditation means for reputation, 3 versus 4 years, and then combined residencies like EMPs, EMFM, EMIM. By the way, please stop me at any point. This is a small, and I love the word that Nick used, intimate group. So please stop me at any point if you have any questions or would like to make a comment. All right. So when we actually poll students and residents, for that matter, about the one variable that's the most important when it comes to applying for residency, they all say the same thing, and it's location. When you're looking at where to go for residency, where to even apply for an away rotation maybe in your 4th year for emergency medicine, think about, how does this location fit in with the rest of my life? Is my significant other never going to be happy in Florida? I saw you back there, Tom. Do I love the mountains? Do I need to be by the ocean? Do I need to be in a big city? Is my partner tied to a particular industry that requires that we be in a certain part of the country? So does it fit with the rest of your life? Then the next thing to kind of think about is the catchment area for the ED, the population that you're going to be serving. Is it broad enough and sick enough, really, to give you the experience that you need or you want in residency? Cost of living is important. There are all kinds of online cost of living calculators that you can use to compare with your current city where you live. And then what kind of options do I have after I finish residency? Do graduates frequently stay there, or do they always go because it's a completely closed market? All things to consider when you're looking at where to apply for residency. There are different kinds of residencies. So academic residencies is your traditional kind of large tertiary care center. There's usually lots of other residents there in just about every specialty and fellowship you can think of. That's a plus and a minus. You can learn from those people, but it may also mean that you're competing for procedures. Lots of other learners, so medical students, if you're interested in teaching, this is probably an environment that is comfortable and desirable for you. And then really the focus is on academia, right? So research, teaching, and service. So if those things appeal to you, you may be more comfortable in a university or an academic program. County residencies, on the other hand, are usually very high volume, very high acuity, fast pace, low funding, so you may not have the latest resources, and you have to be resourceful frequently in these places. Usually there's a pretty intense trauma experience and frequently an underserved population. So if that's what appeals to you, if you want to be a really, really good clinician who practices in areas with low resources, that may be the place for you. And then there's the community residencies. And these are highly variable, and they're getting even more variable. So it could be a high volume, high acuity place, or it could be a very low volume, lower acuity place. It could be very well funded, like by a contract management group. It could be more kind of business related, more education on things like billing and coding and EMRs. So if that's something that's interesting to you, that you think you would be comfortable at, look at more community programs. Size does matter. I don't know if anyone has already decided that they're interested in pursuing perhaps a couples match or something like that. But when you think about the size of a residency class, a class with 6 residents versus one with 20 residents, the dynamics of that program's match are going to be very different. So really think about whether you are the person who would do well in a very small residency group where you know everyone, even if you can't hang out with them all the time, and in fact you probably won't in a very small residency program, versus someone who would appreciate getting to know a lot more people who have a lot in common with you, and spending more time with other residents in your class. Along with bigger residency class comes a larger faculty, size of the facility, size of the ED. So think about how your interaction in those type of situations would impact your education. And I put this slide up here with the EKG because hopefully for everyone in the room, reputation means the same as this EKG. Really, it's uninterpretable. If you ask 5 of us, you're going to get 5 different answers about where we think the best reputation, the best EM residencies are. So really, as long as the programs are RC accredited, that's the gold standard for EM residency. And this past match, we had an interesting scenario where a lot of the traditional osteopathic residencies underwent ACGME RRC accreditation as well. So you're starting to see the field open up quite a bit. And again, as long as you have RRC accreditation, that's really the standard for whether a program meets the requirements and has the oomph needed to give you the training that you need. They're all going to be good at that point. So, did you guys go to a 3-year or 4-year program?
I went through a 3-year program.
I did a 4-year program.
4, me too. So that's unusual. Actually, we flipped the statistics. Usually it's about 1/3 4-year, sorry, 1/4 4-year, 3/4 3 years. But you've got 4 of us in the room, and 3 of us went to 4-year programs. I very vividly remember one of my senior residents in my first year of residency saying, "God, I wish I hadn't done this. It's the $250,000 mistake." I didn't feel like it was a $250,000 mistake. I'll tell you, I felt very prepared after my 4th year, but I think it really depends on the individual student. There were definitely people in my class who were done after 3 years. They didn't need that extra 4th year. And there were people who were done, like me, kind of halfway through. I felt like I probably didn't need the last 6 months, but I appreciated the time to continue to hone my craft. And then there are people who needed the full 4 years. And there are programs out there that really spend that extra year doing kind of things that you might be interested in, like a more intense EMS experience or a more intense talk experience or research. So really think about whether that 4th year is used in a way that would be useful to you. And then what do you want to do after residency? So if your goal is to be an academic emergency physician at a site that has a 4-year residency, there's no way they're going to hire someone after a 3-year residency, because that would mean their faculty basically have the exact same experience as their residents. If you're interested in doing a fellowship, think about how an extra year of residency means that you're in training basically for an entire another year, even with fellowship. And then what are the other priorities competing for your time? So if you need to be out of residency because you need to get on with your life, that's perfectly reasonable. 3 years is probably your way to go. And then combined EM residencies. Is anyone interested in one of these right off the bat? Cool. So we have an EM Peds residency at our institution. You guys have EM-IM at Ohio State?
Yep.
We have EMIM.
EM-IM, no combined? Yeah, so these are usually 5-year programs. You kind of shave off a year, and you are eligible for board certification in both specialties. So our residents complete their EM Peds residency, and then they sit for both the EM boards and the Peds boards. The biggest advice I can give you for this, because I don't have this type of training, but I work with the residents, is find a mentor. So you have to have a really good reason for doing one of these things, and you have to have a clear plan as to why you really want both of those residencies. And that's all I've got for you. What questions do y'all have? Yeah.
Can you elaborate on the point you were making about couples match as a program?
Yeah, so if you're couples matching, there's two of you. If you're both going into EM, that means that you're going to take up a third of all of that residency spots for a year. So some programs are actually just fine with this, but there's a lot that aren't. The small ones sometimes struggle with it.
You're specifically talking about an EM couple as opposed to like an EM radiology couple.
Right. You know, so if you are couples matching with someone in a different specialty, it really depends on the specialty. I'll tell you, the year I sweated the most bullets was the year I had an EM applicant whose couple was going into plastic surgery. I was really worried about him because plastics is such a competitive match. If your significant other is going into psychiatry or family medicine, your chances are going to be just fine.
I just wanted to mention one thing too, that one thing our program director's kind of doing is talking about a 3+1 training. We had talked about fellowships, but I can tell you I did my residency training at Wake Forest, which is a great program, but at the time they only had 2 fellowships. They had sports medicine and peds, and I didn't think I really wanted to do that. But in hindsight, if they would have had EMS or disaster medicine, or maybe even education, I probably would have done a fellowship. So it's funny, you reflect on your personal experience as you're advising other students. And one thing I've started to advise some of my students who are really passionate about one thing, like ultrasound or peds, is to look at programs that have a strength in that, because it's really easy to add a fellowship onto a residency training program when you're already there. But it's hard to move for a year. It's a little bit more difficult to do a fellowship when you're kind of moving around. The other thing I'll say is our residency director told us it takes about 10 years to be a good emergency physician. So I'm starting my 12th year as faculty, so I'm hoping this is the year for me. But, you know, in hindsight, I've talked to some of my colleagues that trained at 4-year programs, and most of them universally say, I'm glad I had that. And I can tell you, my first year as an attending, I was like, man, I wish I was still a resident sometimes. But, you know, the take-home point is a 3-year program doesn't leave you a lot of options for electives. But the RRC and the ACGME, those groups are going to make sure that you get the training you need. I think we really make sure that our graduates out of our 3-year program go to a place where they're going to be well supported. When I started at Ohio State, the first couple months, they almost always had double coverage on, and I was able to ask them questions and things like that. So, you know, we're offering these opinions of, you know, these are different training options. If one was right, they would all be that, right? But there's one that's going to be right for you, and it's also strange when I talk to students how they find the right one through the match. They're just like, this is the perfect program for me, and the match actually works pretty well a lot of the times in that way. So,
yeah, the number 2 variable that people always cite when they talk about their most important criteria for determining where to go to residency is fit, which is really hard to describe even, but you'll know it when you see it. I wanted to dovetail off the fellowship thing. So there are only a handful of ABEM, American Board of Emergency Medicine, boarded fellowships. Sports medicine, peds, critical care, tox, EMS, pain medicine now, hyperbarics. But there's like dozens of non-ABEM boarded fellowships. And actually the SAEM website has a list of all of the fellowships that are offered at each site. So if you're interested in some particular niche within emergency medicine, that's probably our best source to find it. I saw it.
My comment was only going to be if you're thinking about a 4-year program, make sure that your 4th year, like she spoke about having a tox focus, or some folks do, you know, a month BMT. Make sure you're getting something out of the 4th year, and it's not just you slogging hours in the ED
I'll
Other
just-
questions? Well,
yeah.
we got one more.
With regards to location, advice for transplanting cross country, I know that there's some difficulty with your East Coast program going west.
Yeah. I mean, it's like any other big move. I think if you approach it as an adventure, it'll be more fun.
Oh, but how do you improve your chances?
Oh, great question. So if you are an East Coast person, how do you improve your chances of actually matching into a West Coast program, that kind of thing, or vice versa? I'm sure there's going to be some discussion about this later. However, my biggest advice is do an away rotation in that region. So it's a small world, and regionally it's even smaller. So, you know, my letter of recommendation from the University of Arizona means a lot, probably to the Southwest cohort, and probably a couple people who know me well. But it really doesn't mean a whole lot to people in the Northeast who don't know me. Whereas, if my resident or my student does a rotation in Manhattan and gets a SLO from one of the really good programs there, they all know that person. They all know that SLO. It's a way of kind of unlocking a region.
Yeah, and I'll just add to that. You know, we're a Midwest institution like there's here, and if you want to stay in the Midwest, you probably want your away to be in the Midwest. So, you know, I usually advise Ohio State students that want to stay in the Midwest to do, you know, Pittsburgh, Indiana, Chicago, Michigan, Cleveland, Cincinnati. Those are kind of the areas. And, you know, your CV, your body of work is going to have kind of a Midwest flavor to it. But if you want to go, you know, to the West Coast, which we have a lot of students that want to go to California and Utah, we often have them do an away there, or at least get out of the Midwest for their away, because, and this is just a perception, I don't know if it's fact, but I think a residency director is going to see where you did undergrad and med school, and, you know, they're going to make an assumption that this person's going to want to stay in that area or go. And sometimes those assumptions aren't true, but that's the value of the away rotation, and we're going to talk about it. You know, that's one of the things where you can help yourself. I agree.
It's probably pretty context specific too. Like, Tucson, Arizona is a place that most people probably wouldn't be interested in living if it just came up in the topic of conversation. So we genuinely look for people who have some kind of tie there. Not to say that we don't accept students from all over the country who don't have ties there, but when it comes to priorities, that's one of the things we do look for. Speaking of aways, by the way, I don't know if you all know this, but BSAS moved to a whole new platform. So those of you who are rising fourth years, if you haven't already gotten your away rotation, don't panic. I know I have a stack of about 200 of them waiting on my desk at home as soon as I'm done with this conference to go through. So.
The other thing I would just say is that if you are looking to switch coasts, in addition to doing the away rotations, use the personal statement to your advantage, and you can elaborate in there why you might want to go to a different region, because people actually do read those, so you can use that to your advantage as well.
Great. Thank you, Kathy.
Thanks.